I'm Dr. Natalie Marks, and we're back with a quick cup of knowledge. Joining me today is Kristen Cooley. She's a licensed veterinary technician and specialist in anesthesia and analgesia, teaching at the University of Wisconsin School of Veterinary Medicine. Thanks for joining us.
Thank you for having me.
And I'm really intrigued by your lecture that you're giving here, Treating Pain Doesn't Need to Be a Pain, How to Institute Positive Change in Your Practice. So I want to start out, how did you become interested in being a pain management champion?
Well, I think that those of us who are involved in pain management are people who suffer from pain ourselves. So we have kind of inside knowledge. And seeing other species or other people in pain kind of brings out empathy. And I want to step in and help them. And seeing that in veterinary patients and having people say things like, oh, they'll be fine, and then, like, thinking back to my own pain, if somebody were to say, oh, you'll be fine with your headache or whatever, it makes me sad. And so that was kind of the first step that I took to becoming so interested in pain management, is because I'm a chronic pain sufferer myself. And so I don't like to see that in my patients.
That's very interesting. And I think there's also a lot of myths and misconceptions of what pain actually looks like in our patients, both from a practice perspective, but also, of course, from a client perspective, right? And what are some of those that you commonly hear?
So a lot of people, a lot of clients, including my own parents, think that animals will vocalize when they're uncomfortable. And that's actually, the opposite is almost always true, because hiding pain is innate and evolutionary. And animals that show that they're painful then become a target for either, like we see this in chickens. I have a flock of hens, and when one of them is not feeling well, the others will attack it. And so if that animal is showing signs of pain or vulnerability, they're a liability for the group, and so the group wants to get rid of them. And so animals have evolved to hide pain to, like, as extensively as possible. And so our prey species, especially chickens, horses, pocket pets, they're the hardest to recognize pain in, because they are experts at hiding it. And in dogs and cats to some extent as well, although we've gotten really good at figuring out the different types of behaviors and how that could potentially translate into something that they would do when they were feeling uncomfortable or when they were painful.
And I think this is a really great role for a lot of the veterinary technicians who feel underutilized or stifled or not necessarily empowered to the level that they feel they can be contributing to practice, because they're spending a lot of time with hospitalized patients, right? They're doing a lot of the dentistry and surgical induction, recovery, and care. And this would be, it seems like, a wonderful place to empower some of those technicians to become more involved and invested in those cases and giving feedback.
Yeah, and I think empowering is the right word to use too, because it really helps you enjoy your career and your job when you feel like not only your voice is being heard, but that you play an important role as a team member. Like, hey, I'm on the front lines here. I'm the one that's doing treatments every 2 hours in this patient. So I'm the one that knows when something changes. And if the veterinarian that you're working with is not believing you, I think that the problem is a little bit bigger than you. I think and the steps to change that are a little bit more challenging, but it's not insurmountable. It's something that you can overcome if you kind of handle it delicately. And a lot of times you need to look at yourself and how are you coming across to these other people. Are you, when we're passionate about something, sometimes that passion can come across as anger. And if you're like, when you're approaching the clinician about a painful patient and they're turning their head to you, is it because of the way you're approaching them? So I think the first step is always to look inside yourself and say, how are these people perceiving me, and is there a way that I can change that so that I'm more believable or more respected? And thankfully, we have these opportunities to become specialized as technicians, whereas when I entered the field, that wasn't the case. And so I always thought the next step was to be a veterinarian. And then when I realized that I could specialize in something and that would empower me and make me like elevate my level of, like just elevate my career in general, that was super empowering. And then, I couldn't get enough information. Like I was so hungry for knowledge. And if you have that in you as a technician, that hunger, then you can go very far. And I think that as technicians, we need to take a chance. Like we need to step out of our comfort zone sometimes in order to grow. Like you don't grow by doing the same thing every single day. Like you need to, take a step out of that box and think, how can I be better? How can I make myself more comfortable or make myself feel like I'm utilized in my work?
And that's a great option for people who are interested in specializing. But not every tech needs to do that, or maybe has that aspiration. So for those technicians who are inspired and want to do more in their immediate practice for pain management, and maybe now are doing just a couple classes of drugs and haven't instituted other levels of pain management, what are some other options that they can start investigating and learning about that they could bring back and start using for their patients?
You don't need to be a VTS in anesthesia and analgesia to be a pain champion. All you need is a passion and a desire and motivation. One of the places that I started was I joined the International Veterinary Academy on Pain Management, or the IVAPM. And I used these, this organization is on the cutting edge of pain management, and they offer a lot of resources for technicians and doctors to make those steps forward in becoming a pain champion. But I think the number one thing is to educate yourself. I mean, drink all that knowledge. I mean, obviously come to my lectures, but you have to recognize that passion, and then you need to make a plan and say, okay, I really want to be a pain champion in my practice. So what I'm going to do is I'm going to learn what I can about the physiology of pain so I can have a better understanding about what's going on inside my patients. And then once I understand that, I'm going to do a little bit of research and try to figure out all of these different drugs that are available to us. How do they work? How can I utilize them? Is this something that we already have in our practice, or do I need to try to make, try to bring them in, which can sometimes be a challenge. And then understand the different types of pain scoring systems. Find one that you like and that you think your practice will like, and bring that in. And then, go to your practice manager and say, listen, I've done all of this behind the scenes work. Now I'm ready. You're making a proposal, and you're saying, I want to up our pain game in practice. And so here is my plan, and here are these pain scoring sheets, and here is this nice video that tells, that will train the staff on how to utilize these to the best of our ability. And then, we can tout that to our clients and saying, we are IVAPM members. We are very well versed in recognizing and treating pain in animals. And then once you see all the options that are available out there, so it's not just different pharmaceuticals, but different modalities too. So maybe you need to go to a conference and do a wet lab on how to do local anesthesia, so local blocks. There's so many options out there. And I always tell people, if you see a nerve, block it. Block it. The sooner you block it, the better. Don't cut it and then block it, because that doesn't work so well. But once you understand how the pain travels through the body, then you understand how to best treat it. And using local anesthesia is one of our best tools. And it's so inexpensive. And people are afraid of local anesthesia, but only because there's a toxic dose. But there's a toxic dose in every drug. And as long as you know what that dose is and you stay below it, you're in good shape. And so I think again, practices sometimes need to step a little bit outside of their comfort zone in order to improve.
Well, you've given the people watching a tremendous amount of pearls, and I'm certainly inspired to up our pain game at our practice. So thank you for all that you do for the profession and inspiring technicians and veterinarians to do better in pain management. I wish you the best at the conference.
Thank you.